This is a graphic organizer describing hypoplastic left heart syndrome and the Norwood procedure, which is performed in infants who are born with hypoplastic left heart syndrome. Hypoplastic left heart syndrome involves the following four features. 1. The ascending aorta and aortic arch are hypoplastic. 2. The left ventricle is underdeveloped and is also hypoplastic. 3. There is a large patent ductus arteriosus, which supplies the only source of blood flow to the body. 4. There is an atrial septal defect, or patent foramen ovale, which allows the pulmonary venous blood flow to reach the single right ventricle. This circulation is only sustained through the constant infusion of a medication called prostaglandin, and if the medication is stopped, the patient will decompensate and likely die. In order to allow the infant to continue to live, a procedure must be performed in the first 2 weeks of life. The most common surgery is the Norwood procedure, which is the first in a series of 3 surgeries that are typically performed in children with hypoplastic left heart syndrome in the first 5 years of their lives. The Norwood procedure involves the following 5 steps. In step 1, the patent ductus arteriosus is ligate, and the hypoplastic aorta is opened longitudinally from the descending aorta to near its origin at the heart. It is now splayed open and can be used to construct a new aorta, or neo-aorta. In step 2, the main pulmonary artery is divided and the distal end is closed. The trunk of the main pulmonary artery is now available to be used to create the proximal portion of the neo-aorta. In step 3, a Gore-Tex modified Blalock-Taussig shunt is used to connect the innominate artery to the right pulmonary artery. This is basically a man-made tube that allows for a source of controlled pulmonary blood flow. In step 4, the neo-aorta is constructed by utilizing the proximal main pulmonary artery that has already been transected. The hypoplastic native aorta that has been splayed open, and a patch so that a new outflow tract called the neo-aorta is created for the single right ventricle to pump blood to the body. In step 5, an atrial septectomy is performed, in which a large hole is created between the left and right atrium. This allows the pulmonary venous blood flow to return to the single right ventricle in an unobstructed fashion. In order to create this graphic organizer, I used PowerPoint, images obtained at the Heart Encyclopedia developed by Cincinnati Children's Hospital, and a sound recorder. The images were copied and pasted into PowerPoint, and then I used shapes and text boxes to insert labels for each step. The narration was recorded using sound recorder and then inserted as audio into the slides. The purpose of the graphic organizer is to serve as an educational tool for parents, medical students, residents, and any other medical professionals who may benefit from an understanding of the Norwood procedure.